This segment of Delmarva Life is brought to you by Peninsula Home Care.
Pneumonia, kidney infections, even a bloodstream infection, all commonly known. But there's a life-threatening complication of those infections, and it's called sepsis, that is not too well known. Sepsis has been diagnosed as early as 700 BC, but a recent article in the Journal of the American Medical Association presents new definitions for sepsis and septic shock. Researchers say in the last 30 years, new definitions were needed because of more sophisticated treatment in intensive care units and better understanding of what sepsis does to the body. It's caused by something as simple as a small infection. It's more common than heart attacks. It claims more lives than cancer. Yet half the adult population has never even heard of sepsis. So joining us to talk to us more about the causes of and symptoms and treatment as well of sepsis is Nancy Bagwell, who's the Area Director of Operations with Peninsula Home Care. Thank you so much for joining us, Nancy.
Thank you.
Okay, so big question off the top. What exactly is sepsis and how common is it?
Well, sepsis could be easily described as your body's overwhelming response to a threatening infection.
Okay.
When someone develops sepsis, they typically are already having an immune system that's battling something else. So when your body then has an infection, it sends your immune system into overdrive. And what that happens to the body then is there can be responses such as widespread inflammation, leaky blood vessels, blood clots. Those sorts of things can lead to tissue damage, organ failure, and sometimes even death.
Wow.
And unfortunately, even with modern medicine, sepsis is still the primary cause of death from infection.
So it's pretty common.
It is.
Wow, so what causes it? Why does it, what starts it in the first place?
Well, sepsis is always caused from an infection.
Okay.
And so it can come from anything as simple as a cut or scrape, something minor, or it can be triggered by things such as pneumonia, meningitis, appendicitis, something like that.
Is there anybody in particular more at risk than anybody else?
Well, actually, because we've talked about our immune system, the immunocompromised, so the person that already has a weakened immune system, and oftentimes we think about the elderly or someone with a chronic illness such as cancer, diabetes, or kidney failure, but also at risk could be babies or young children, or even people who have wounds or severe burns.
Wow. So what about symptoms? What can we look for?
Well, with sepsis, unfortunately, there's not one symptom that you can watch for. Typically, it's a variety of things, and those can be anything like we're used to seeing with infections, such as vomiting or diarrhea, sore throat. But it can also be one or many things, such as shortness of breath, you're sleepy, it's hard to arouse you, you have fever, chills, maybe you have pale or discolored skin, you may feel like an intense pain, or even, I think I might be dying.
Wow.
Right.
It can feel that. Is there anything I can do to prevent it?
Actually, there is. The best thing that we can do is to keep our immune systems healthy, and we do so by being proactive to prevent infection.
Right.
So we want to make sure hand hygiene is extremely important. Bathing. We want to make sure if you do have a cut that we clean that, or a wound. And then just be conscientious of the signs and symptoms when you have an infection so that it doesn't escalate into sepsis. Again, that being shortness of breath, fever, chills, maybe someone is disoriented or you can't arouse them from sleep and that sort of thing.
So prevention is really, really important because it's kind of prevalent around here, isn't it?
It is. So as you're looking for the signs and symptoms of sepsis, it's very important to remember that here on the Delmarva, sepsis is one of the top 5 reasons that bring people back to the hospital and cause readmissions.
Ooh, and we don't want that.
No, we don't.
Nancy Bagwell, thank you so much for sharing very important information with us this afternoon. Stuff you need to know. If you'd like more information on Peninsula Home Care, just go to delmarvalife.com.